My name is Kaylin, and I will be doing my presentation on culture and mental health, focusing on the Latinx patients. So, working with patients from a different culture is obviously going to pose its challenges, but it's just a matter of understanding their culture and their values and how they view certain mental health disorders or, medical conditions. So, a culture bound syndrome, as defined by Keogh, Timpano, and Schmidt, is that these syndromes are proposed to be bound to certain cultures and distinct from other psychological disorders. And here in this diagram, you can see kind of the Latin European and Latin American countries and territories that would probably have some of these disorders or mental illnesses. So some of the illnesses or disorders that somebody may have from a Hispanic or Latinx country or culture would be the ADN, which is attack of the nerves. And it's just an out of conscious state caused by evil spirits. And in Western cultures, this would be referred to as either a possession or more commonly a panic attack. There's mal de ojo, which is a medical problem caused by the evil eye from another individual. And then there's sustos, miedo, espanto, and pasmo, which is just tiredness, weakness, caused by a frightening situation or experience. And then there is wind or cold illnesses, which is kind of just the fear of cold weather or wind. And it's a belief that supernatural/natural elements are not balanced. Spirituality in Hispanic cultures is very prevalent, and there's also a great emphasis on, supernatural forces and the use of saints as kind of protection things. They serve as warnings also for other things that may be going on. And in this culture, it's not considered abnormal or uncommon to see or believe in supernatural forces or religion. And this is one of the most common culturally bound illnesses, ataques de nervios. It's kind of similar to a panic attack, and some of the common symptoms include uncontrollable shouting and crying, trembling, and a feeling of heat in the chest that often rises up to your head. It's seen mostly after a distressing event, such as a conflict or death of a loved one, and it is more common in females as compared to males. And here are my references.